Welcome to another episode of Courageous Me. And this is going to be a heart-stopping interview for many reasons, because our guest today is actually a cardiologist or a heart failure specialist, which I'll get her to explain. So it's Dr. Jodie-Ann Senior. And Jodie-Ann, before we get into some of the nitty-gritty and, who you are, could you just share why you're excited to have a conversation with me today about courage?
Thank you, Kim, and thank you for having me on. This is pretty exciting. Courage for me is one of those themes that just has kept popping up at me and tasking me with its attention since from a really young age. And I've had to kind of explore, what does that actually mean for me? How do I have to meet that challenge? How do I show up for it in so many aspects of my life? But then I also do a job where I get the privilege of watching others demonstrate their own courage in their own journeys, and that's pretty remarkable. I feel really privileged to be able to get to do that too. But if I may say, when I think about it, I think a lot of people think about courage along the side of bravery, of one big act, boom, boom, you do something. But I kind of think of that like it's not maybe even a conscious thought. When something comes up and you've just got to make a split decision, and people look back and think, wow, that was brave, wow, that was courageous. But maybe that's not actually what it takes. For me, it's been more showing up day after day after day when things are really tough, when it's a grind, when you don't feel like it, when you already feel overwhelmed and overburdened, you don't have the confidence or feel like you've got what it takes to get through whatever that challenge is, but you keep showing up. And I think in my 20s, I read, might have been later than that, a quote around sort of what Christopher Reeve had said. The actor had the accident. And I kind of thought about his life and I thought, gee, wow, here's a guy that good looking, loved by a lot of people, this movie star, world at his feet, great family. Then he has this awful accident and he's left a quadriplegic. And so much of his previous life and world just got taken away in an instant. And yet he had this approach, like, I'll misquote this, but, if you think that sort of life is analogous to a game of cards, then you play the hand that you're dealt. So good, bad, ugly, whatever, you play it because you believe in it, you believe it's worthwhile. And I think if a guy like him can have that happen to him, what excuse have I got? What excuse have I got not to show up, not to have a go, not to be brave, not to have the courage to do the thing that scares me, including coming on a podcast or showing up on social media? It's like, it isn't really such a big deal. Like, we get to show ourselves and we're vulnerable and we make a mistake or we look stupid. Is that really so bad? We're all human.
Yeah, but you know what? This is what I loved about when I met you, and we met at a lunch just recently. And you're a cardiologist, right? You're a heart failure specialist. You give life back to people who might not otherwise have a life. Like, to me and to so many others, someone who does that work is kind of, like the Christopher Reeve and Superman, and like it's supernatural kind of work. So to even hear you say that you might have to reach in and find some courage or have had to find the confidence to do something, whatever, I don't know, it kind of normalizes that you also are a human being. And like Christopher Reeve, you have got cards that are dealt with you that you have to deal with. So yeah, I find that really interesting. And I remember when we did have the lunch, I just felt like I was talking to another girl, like, which is so cool, even though you've got this super brain and do this incredible work. So, there's so many questions I want to ask you. Can you Where do you think is the first time where you really had to reach in and find some courage? And take us as far back as you like.
Yeah.
But where was that first moment where, and you might not have even thought it was courage at the time, but to someone else listening in, we'd go, fruit, that's courage.
Yeah. Um, probably, yeah, there are lots of smaller things, but probably the biggest thing that jumps out at me when I was young was just my dad died. He died in a skiing accident. I was 17. I was just a quarter of the way through my final year in school. In that year, I also lost um, my grandmother on my mum's side. So that was in April, exactly 3 months to the day my dad died in the skiing accident. And then during my exams, my grandfather on my dad's side died. And I kind of felt like I didn't have anything left to give at the end of that year. And I don't know, I did a lot of personal development myself. There wasn't any counseling, there wasn't, oh, we don't talk about this, it's, oh, something bad happened, let's just push it under the carpet and let's not speak about it because that might be upsetting. And I kind of resented that, to be honest. And people's attitudes were very kind of, oh, well, you'll be right. It's like, I don't know, my world just caved in. He was everything to me. And I feel like now I'm exposed. I don't have that safety person. I don't have the person I looked up to so much. And I did have my mum who showed courage in her own way. The way she could just put whatever she had to deal with aside, even if it's for a short amount of time, and just take another step. And, it took me years to recognize that, but her courage in the face of what happened, her not just falling into pieces and letting everything just fall apart, the courage to keep our household together, to keep us at school, to get us through until we were adult enough to start looking after ourselves. And as a corollary of that, my world fell apart. I'm trying to get through my last year of school. I think I want to do medicine because I like biology. I like how things work. And I think I told you at the lunch, I didn't actually want to be bored, and I figured medicine I would never be bored, and that's the honest truth. And I can honestly say that never has had a dull day in my life. So
It's
it's
a
been
good enough reason to go off and, become a
yeah,
doctor so you
yeah.
don't get bored.
Yeah. I mean, this is a 17-year-old's perspective of the world, so don't take it with too much gravitas. But
So you didn't sort of grow up from being a little girl always thinking, oh, I want to be a doctor when I grow up. That wasn't
I
your
don't
card.
think so. It was a thought, but there's that thing of like, oh, am I really good enough? Am I smart enough? Can I really do that? So I think for a long time, I hid that idea from myself, and I had friends who'd say, oh, you should be a doctor, or you should be, and I'd just be like, oh, maybe, I wasn't brave enough to commit and say, yeah, that's what I want to do. And so, I did get into medicine. I mean, at school, I was always, bright amongst my peers and did well. I worked hard, but I just thought that's just me working hard. There's nothing special about that. I just worked really hard. And then I got into university, and I'm amongst a roughly 150 odd peers. And I tell you what, these people are really, really smart. And I'm now in this big pool of really, really smart people. I felt really, really dumb.
Oh my God, you've got into medicine,
Yeah,
right? Which, you got to have the smarts to even get there.
yeah,
You are in a pool of people and you feel dumb.
yeah. And still
Holy
do.
mackerel.
I still do. I have colleagues I'm in awe of with, their accomplishments and how their brains work. And, I'm fascinated about that kind of stuff. Um, but honestly, I just lost my dad, and the first 2 years for me were incredibly tough. My head wasn't really in the game. I was working hard, but I didn't really know what I was doing, and I was miserable. I probably needed a lot of counselling or something. Anyway, um, I was pushing through that, and there was this point at the end of my second year, and I felt like I was just never going to get through this course. And I, many times, like a couple of my colleagues and good friends did, consider dropping out. But I felt from my mum I couldn't do that, partly from my dad, who wasn't around anymore. And I think were it not for, one of my mentors, shout out to Tim Bennett, who's a plastic surgeon. He was my anatomy demonstrator, and he said, I know you don't think you can do it, but you have to trust me. I believe you can do it. You've got what it takes as much as anyone else here. And, you just don't give up. And I took that to heart. I honestly didn't feel any of those things he said. I didn't feel good enough. I knew that I wasn't doing great in my first couple of years at uni. I felt like really like on a drift, and I was just like, yeah, how am I going to get there? I don't know. I've got another 4 years to go. And I did this one little stint in my third year where we got to do something, I think it was for psychology, but I went to an emergency department. Tim actually happened to be there. That was just coincidence. And I got to spend a little bit of time shadowing in the emergency department, and I just loved it. I just thought it was so what I wanted. And then I just had to hang on to that feeling and keep showing up and keep working this out and figuring it out until I got through my 6 years. And I still didn't know for sure if I was going to be okay at this until literally my first day as an intern. And those first 2 weeks, I was doing surgery. It was horrendously hard. It was horrendously busy. The hours were insane. I think one time in my first weekend, I wanted to throw my pager against the wall. I was just like, I can't bear this anymore. But at the same time, I was just super excited and lit up by this thought that I could actually make a difference, that I could help people, that I could be trusted to look after their health and help restore that. And it was such a tremendous privilege to be in that space. And it was just, I don't know, it was insane. I can't even describe it. And I thought for the first time, I was like, oh man, I am so grateful I stuck it out.
And oh my gosh, but see, we're talking 6 years here,
Yeah,
right? There's other
six
people
years.
that would not give something 6 years to work out whether they wanted it. Do you think when Tim, is that right? When Tim said that he saw something in you that you didn't, what do you think that was? Because I think that is, I hear this story all the time where someone else has seen something that you can't see yourself, and that has been what's then allowed you or driven you to keep going. What do you think he saw that you didn't?
To be honest, I'd have to ask him. I really don't know. I mean, obviously, he saw how we were and how we worked, and they get to know us a bit because we spend a lot of hours with them. Um, and I don't know. I mean, the cynic in me says, well, 150 of you made it into the course. If you made it into the course, you should have what it takes to get to the other end. But he didn't reveal much himself, but I often wonder, did he ever feel like that himself? And then here he is, he's going to be a plastic surgeon. He's going to, do surgical training. It's really hard to get into. And it's really, a massive climb to get to that point. Um, he never said anything, but I just wonder how many of them, and I saw it later with other people, right? Tried 4 times to get into a surgical program or get through an exam or whatever. And you've got no idea how tough some of these things are. But, most of my training actually at the end of it, apart from, yes, you have to have the knowledge, you have to have done the work, you have to be able to apply it. But then the actual exam structure itself, to me, what it felt like in the end was a test of endurance. And you think about what a say a transplant surgeon does, or any surgeon for that matter, and they might have to stand at an operating table, concentrate for 5, 6, 7 hours, maybe longer. They're the one person in the room that doesn't get a break, doesn't get a chair, doesn't get to go pee if they need to. They don't get a toilet break. They don't get to eat. They don't get to drink. And they've got to be solely focused on what they do, no matter what. Take in physician training on our weekends on call, we're getting literally paged just constantly for 12, 14 hours straight, with demands from the bottom floor of the hospital to the top floor of the hospital, and it's just coming at you and at you and at you and at you. You can't just go, oh geez, I can't be bothered with this anymore. Pages are going in the corner. I'm going out the door and going for a walk.
It's my lunch break. Can you please? Don't
Dude, leave
interrupt
me alone.
Yeah. So
No,
how do you do that then, Jodie-Ann? How do you, like, obviously you can't just teach someone endurance and going into this space. So you get through your 6 years and it sounds like you've just flown through, albeit a lot of hard work, but you've gone through and continuing on. How do you find that endurance? Like, where does that come from? Like, this is a side note, but I went and saw Taylor Swift a couple of weeks ago, and how she has the energy to perform at her level for 3 hours. I think there's more to it than just being, cardio fit. But
Yeah.
how do you do it when the work, as you say, it could be 8, 9, 10 hours in surgery and you can't slip up, right?
No.
You can't. There's someone's life on the line.
Yeah.
How do you do that?
Partly you're trained, along the way in lots of different ways to, and I hate to say this, but keep neglecting your own needs in favor of serving someone else. And I think nowadays in medicine, they've pulled back a little bit on this to try and educate the students to take more self-care and more awareness of that, which maybe not a bad thing, but at least for me, years of putting aside whatever my needs are and staying focused on what was really acutely important, and just then taking the next step and then the next step and the next step. So, I won't think too far ahead if it's becoming overwhelming or the demands are too high. You just think, okay, right, I've got these 5 tasks in front of me for this second. I need to prioritize which one of those is going to be the highest in ranking need, and then go deal with that. And FYI, and I did say this once, I was just being harassed, and I was in a pretty stressed point, and a nurse came, like she was before text, sorry, before mobile phones, I'm that old, paged me. And when I picked up the phone to talk to her, she was harassing me to come and do a death certificate. And I literally thought, they're not going anywhere. What's the rush? I've got these live people I have to deal with first. And it sounds terrible, but I literally was just compiling that, what is my highest priority here? There are people I can actually make a difference to. I don't think I could do too much for that one. Yeah, so, that's not something I'm particularly proud of, but
I
it's
guess
real.
that's part of the reality of the decisions that you were faced with, where you literally had to prioritize, I've got these 5 or 6 things in front of me, and these can be life and death
Yeah.
decisions, right?
Yeah.
So you have to be able to make that. You said that actually earlier on when we talked about courage, that sometimes it is where you've got a decision in front of you and you don't have the luxury of taking your time or going and gathering consensus or finding the relevant information. You've got to make that decision there and then and go with it. How's that played out? So I'm really interested because, yeah, that's the second time you've mentioned that. Or where have you had to do that and the decision you made was right? Or maybe not.
Yeah, in terms of like prioritizing those things,
And
and then
having to make a decision without, you can't consult
yeah,
anything else. Right now, your call is what is going to be the call.
yeah. I mean, I almost have to do that on a daily basis, really, in my work. Um, so there's not, one moment of that, and it is hard because I think you, you can second guess yourself for sure. Um, I think what I come back to is something one of my friends said to me once: you can only make the best decision you have at the time with the information you've got. There's no point then in second guessing yourself and going back and going, oh, I should have done blah, 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 if the information's changed afterwards. It's easy, as we say in medicine, with the retrospectoscope, and you can look back. Hindsight's a wonderful thing, and you have the wisdom to go back and go, I should have done blah, 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 but I didn't, I did this. So, for me in work, that's a daily thing. I sometimes I'm in the middle of consulting downstairs and there's something going on upstairs, and I have to go, okay, I have to make a decision. Is it important enough to deal with right now? Do I leave my patients and my patient list right now, go and deal with that emergency? Do I delegate it to someone else? Do I, what are the other options I have? And I have to make a split decision on that and then hope that it's right. And I also do a lot of, in fact, I had one last night. I do a lot of quality assessment in the hospital at a sort of exec level. I'm very proactive in that team, and so we get to actually do that look back on all these things and see, did we do the right thing? Did we follow guidelines? Did we make a mistake? What should we have done here? What were the factors that led to this error or that? But it teaches you, I think, even going forward, you learn from that, you reassess, and you can make better decisions. And if you do have the luxury of a little bit of time, sometimes just pausing and not leaping, standing back, even if it's like an urgent situation, sometimes just taking a moment, standing back, looking at it, assessing it, and going, right, what is my priority here? What should my role be? What do I need to delegate? Yeah.
It's beautiful, isn't it? Because so many of us in our lives make a decision and then we look back and go, oh, I shouldn't have made that decision. I should have done this, or we have regrets and all of this stuff. And I guess, and if you've made a mistake, sometimes we can carry that around for way too long, and that can then discourage us from doing our things. Whereas one of the things you said at the beginning about coaches, you've got to keep showing up.
Yeah.
So even if you make a mistake, even if you make a decision that retrospectively you might have done something different, you can't wallow in that.
No.
You don't get a chance. You have to keep going. Do you think that's also part of your training that allows you to do that? Because if so, I think all of us need some medical training.
Yeah.
I think it's a
Actually,
beautiful
one
skill.
of the things one of my mentors and educators said in physician training. So once I'd done my intern year and then I'd done some residency years, decided I wanted to do cardiology and transplant. I then had to actually get through physician training exams, which were a hell of a lot of endurance and study. And I remember was Professor Thompson. He was one of my professors at the Alfred, and he said to me before the exams, he says, look, whatever you do in the clinicals, no matter if you think you failed a case, you have to let that go, and you have to just get on with the next one like that didn't even exist, because you don't know if you failed it, even if you think you did. And see, so I just give you a little bit of context. The way the day ran was you got flown in, you flew interstate at your expense, and you went to a hospital you were completely unfamiliar with, patient group you'd never seen before, and examiners from all around Australia. And you had 3 of them on you, 3 each stage. So it was like you were really under the microscope. And you got...
Not intimidating at all.
No. And you have a long case, which is you and the patient for an hour, and you've really got to find out the entire scope of what's going on, and then formulate a plan of how you would present and prioritise the patient's problems, and then discuss that and be grilled on that, your assessment of that. And then you've got 2 shorts, which are clinicals that you do examination in front of the examiners. You can't ask a single question other than, are you comfortable? Is it okay if I blah, blah, blah? But you're not allowed to actually get any clinical information from them verbally. You have to do it all by examination, and then come up with a thesis of what's actually going on with the patient. And maybe all you're told is, this patient has shortness of breath, please examine their cardiac system. Or it might not even be that, it might be more general, and then you have to use that cue to then go and be a detective and investigate. Sounds fun, but in exam conditions it's pretty intimidating. And so you've got 2 of those, and then you have a lunch break, and then you do exactly the same in reverse. So you've got 2 more shorts and then another long. And my first long, I felt I struggled with, but then I also felt like I had a good grasp of some of the key ways to really present that case. But there was this moment where the patient nearly felt he had multiple sclerosis, and as I moved him around, he nearly fell off the examination table. And I was just thinking, oh my God, I could have just failed it right there. You know, if I hurt the patient or something disastrous happened. So I've got this going through my mind as I'm trying to, pull myself together and keep going. And at the end of that, I don't know, it didn't feel good, but I was like, no, you just have to still do the very best you can. And whatever happens, you have to put that aside. Like that's done now. And I'm not very good at that, I have to say. But I was like mentally psyched up to go, no, doesn't matter what you think happened, next. And then focus on the next and the next and the next and the next and the next. And I passed. So it probably didn't go as bad as I thought it went. And I actually kind of felt like it went better as it went through. But there
Is that
you go.
because you got more confidence?
You can self-sabotage the minute you think, oh my God, I failed. And that's what he was trying to get in my head and say, don't worry about whatever you think. It doesn't matter what you think. It matters what they think.
That is such good advice, though, isn't it? Like for life. I know this helps you obviously in the work that you do and to get through your exams, but so much of what actually gets in the way is our own self-sabotage. Yeah.
For sure.
Yeah. So how do you think your training with your work and how do you think that plays out in your everyday life? Do you have moments where you can see that the training actually helps you be a human outside of being a doctor?
Yeah, for sure. Humanity gets in the way all the time. But as I've tried to develop myself around my work, because look, I accept my humanity, but I also want to be the best version of myself that I can. And well, I'm sure sometimes that's not great, but I just get back on that horse and keep going. And so, just in everyday life, how we might approach a problem, how we might speak to a person, a spouse, our children when we're trying to be a good parent and we have no idea what we're supposed to do in a situation. My work has taught me patience. My work definitely has taught me a lot about myself in terms of how good am I at enduring? How good am I at just being determined to succeed, accepting my failures and my weaknesses, and then saying, okay, but what could I do better next time? How could I, okay, might have not done that well. What could I do better next time? In my fitness, I'm constantly, I'm very curious, so I keep learning. Whether it's psychology, whether it's physical health and well-being, and I try and impart that as well to my patients wherever I can, because I'm a big believer that lifestyle matters and that how we take care of ourselves is really critical in health, not just, taking a pill because it's there and it's easy and it's in the guidelines. It might be part of it, but it's only part of it. Don't band-aid a situation. Just be vulnerable enough and courageous enough to look at something and say, okay, is that really going to make an impact, or is that going to just band-aid the problem? And be willing to do the hard work to push beyond that and actually get the result. And yeah, I think my struggles early on in life have taught me that I'm made of tougher stuff. And even when I don't feel like it, like even when I feel like, oh God, this is really hard, I just don't want to. But even then, I can also appreciate times when it's okay to say, actually, it doesn't matter that I feel like I don't want to do it. I'm going to do it because I know it's the right thing to do. It'll be the right thing for me, or it'll be the right thing for someone. And I think the other thing that it's taught me, and courage here for me is a big part of it, is to look beyond where I feel like I've got my fears, my limitations, my deep-seated insecurities, and say, it's okay to be human, it's okay to be vulnerable, but if I stop just looking at myself and worrying about, will I look stupid, and think more about, if I do this, it's going to help me serve someone else better and make a difference, then my little insecurities just float away and go, okay, they're there, but I put them aside in favor of the service to something bigger than myself. And that's helped me do, even public speaking, right? Everybody says that, right? Nobody wants to do public speaking. And I remember my first time I had to stand up in this big forum at the Alfred. It's like rows and rows and rows in this lecture hall, and it's dark, and then there's this spotlight on me, and I'm like, oh God, I do not want to do this. But I prepared for it, and I even did some, meditation, whatever thing before it, because I was like, same with exams, right? You're in that spotlight. It's that same dreadful fear of, I'd do anything not to have the focus on me right now. But you're like, okay, but if I stop worrying about what I am about to do, or whether I'm going to look stupid, or whether I'm going to say something dumb, and concentrate on, okay, I'm giving this lecture because I need to help people understand this topic. Some of them will already know it and they'll know more than me, but there might be a lot of people in the room who haven't even considered this yet. And even if they have, maybe my take offers them something new or different. And so when you start focusing on this is going to maybe help other people, then it becomes easier. Oh, and I have one little other analogy to that I hadn't even thought of till now. When I was a fourth year medical student, for the first time, we started like having exposure to some of the clinical stuff. We were like observing procedures, and we were allowed into an operating theatre. And the guys I were with organised exactly that moment to go into an operating surgical theatre. One of them was very keen on doing surgery, and I was like, I don't know what I want to do yet. My dad was a bit of a fainter. He'd just like at the drop of blood, someone else, he'd just faint. And I was like, oh God, I wonder how I'm going to be. And I found out very quickly, and it wasn't good. So I go into the girls' changing rooms. I change. My colleagues went into the men's room, changed in scrubs, and I've come out first into the operating theatre. And I remember I was with the surgeon, Mr. Jamison, and he was about ready, prepared to do a gallbladder operation. And he just takes one look at me and he goes, and I've never met him before, he goes, come on, you're up. And I'm like, no, not me. I'm like, I'm going to stand at the wall. I didn't say this, because who would say this to a surgeon? I've come up to the table, and he goes, right, put your hands up here. So I've got one hand literally over this guy's heart, and the other one is on the tummy. And he just takes the knife and just goes, and I have just gone obviously white as a sheet. And he's kind of glanced up at me and gone, you better go sit down. And I'm thinking, oh my God, am I going to even be able to be a doctor? Because all this stuff is making me actually faint. Am I going to have to go do psychotherapy, or what the hell? You know, I don't know what I'm going to be able to do. Maybe I'm not going to be able to cut out to be a doctor. And I'm like, I don't know what's going on. And I knew what was going on. I was empathizing with the patient, who actually couldn't feel or see any of this, but I was imagining what this must be like, or whether it's procedure, you know, or someone's got to have stitches or an injection. And I was almost feeling it, and then having this whole fainting response to it. And I was petrified. I'm thinking, I'm never going to make it. And the thing that shifted was that same year and that same hospital, we had to go into the emergency department, and I was told to suture up somebody's scalp. They'd cut their head open, and, you know, I had to do that. And I'm thinking, okay, well, I've just got to do this. But the minute I had to focus on what I was doing and to help somebody rather than just observe it, it all changed. And suddenly
Mm.
I realized I was going to be fine, and that actually I quite liked doing this stuff.
You're not going to get bored.
No, not going to get bored at all.
But you know, I think it's so interesting, isn't it? Just what you were saying even before about that moment, you know, in all the work you do, but suddenly being put on a stage and the spotlight on you, or in exams where you've got all these people looking at you, that when you can shift the focus from you and how you think others might perceive you to I'm in service of someone else and I need to do this in order to be able to help them in some way. I mean, that is what some people spend their lifetime trying to get to that point. I guess your training has meant you've had to take on that viewpoint, which is really interesting, because you said earlier about the fact that in order to be so in tune with what's going on with others, you do put yourself and your needs on the back seat. So what then, in order for you to do that, in order to handle all these situations where to stand up and do the work you do, you have to think about the other person. What do you think the repercussions are therefore to you? Like you said even earlier on about even your own self-care, that is on the back burner while
Yeah.
you care and attend to everybody else. So I guess, especially given you're in medicine and it's all about, you know, caring for the human body and mind and all of that. How do you balance some sort of care for you at the same time as always knowing that your focus is on giving to others?
Yeah. I learned that the hard way, and I watch others, you know, my patients, or carers of my patients too, and I'm very mindful of this for them. Um, there was also this undercurrent of, well, if you are going to like do something for yourself, that somehow that might actually be selfish rather than being self-care. And it was a very loaded kind of emotion around putting myself first. And I really didn't get it until a couple of things happened. First of all, I got to a point where I was really starting to burn out and something had to change. And in my sort of search for what I should be doing and how I should be approaching and really my own learning about myself, I came across a pretty cool Oprah video, and she made this analogy. She had a speaker on that was talking about this, and women who, you know, sacrifice themselves constantly for others. And I think as carers, you know, whoever you are as a carer, then often your needs come last. But at some point you will burn out, and some point your body or your brain is going to say stop, and it keeps saying stop, stop, stop until you pay attention. If you don't pay attention, something catastrophic to your health happens so that you have to pay attention. And rather than get to that point, learning earlier on in that journey to that it's okay to actually take breaks, to take time out, to do something to restore your well-being so that you have more to give. And the way I got it and stopped seeing it as selfish was as simple as, you know, when you're on an airplane and a hostess or a steward stands up in front of you and they're saying, now the oxygen mask will come down from the roof, take your oxygen mask, put it on yourself first, and then help the others, children, older people, whatever. Literally, because if you don't put the oxygen on first, you're going to pass out and you'll be no good to anyone else. And it took that visualization for me to go, oh, yeah, if I don't look after my health, then I'm not going to be in a good position to have a lot to give to others. And so I've gotten a lot better at that in the last decade of my life. It did take me quite a long time to learn it, but I feel then I do have more to give. I've got more energy. I'm more on point, in better able to just listen and be with and absorb and help and be generous with my time with others, rather than feeling hurried and overwhelmed and fatigued and wishing like I really just could go crawl into bed.
Which I'm sure there's many times you want to. So how do you do that? Like, firstly, have you ever, do you believe, suffered from burnout? And what do you actually do? What are some of the rituals or behaviors or things that you do, you know, putting your own mask on first? What do you do to prevent burnout?
Yeah. I asked, maybe because when you're in your 20s, you feel you're bulletproof. I was very disrespectful towards my sleep. Part of that was the job. And you're constantly having your sleep interrupted, and you're lucky if you get any. And that lasted really in my career up until probably easily my mid-30s. And then I was also doing extra night shifts and, you know, all that crazy stuff. Trying to set yourself up, trying to do as much as you can. I was like a doer, not a beer. And then in time, I was starting to learn that wasn't good for my health. It wasn't good for my sanity, and it certainly wasn't good for my personal life. And then when you have kids, also your priorities change again, and you start realizing that, you know, when your 5-year-old says to you, Mummy, I don't want to be a doctor. I said, why not, hun? And I never, ever suggested any of my kids should be doctors, but she literally turned around to me and said, because you're never home. And I was like, that just, it really hurt. And I did make some changes as a result of that. And I started making more of a, it was tough. Again, it required me some courage to actually say, right, maybe there are these parts of my work I need to actually stop doing so that I have more time for my kids or for myself. Back to your question, I'm much more protective of my sleep these days. And there's a lot of science and understanding around how critical sleep is for us in so many different ways, literally to the point of if you chronically get insufficient sleep, that you actually die younger and usually of some horrid disease. So that's number one. Number two, I make sure I get exercise almost every day in some form or other. I suffered a lot when I was young from anxiety and sometimes depression. In fact, I had a terrible incident in my life where I was the victim of a major sexual assault, and I got PTSD from that. And so I had to do a lot of work then. But what that led me to was doing meditation and things like yoga and understanding the benefit of down regulating that stress, chronically being, up and elevated, and learning that physiologically I had some say over that. And I'm going to use that to help my patients. As simple as just doing some breathing exercises can change the way that your body is primed for that fight, flight, and freeze. And being able to understand that just because we feel like we're going to die doesn't mean we are going to die, and that the feelings are just feelings and emotions. And being able to literally generate a peace. And then if I go one step further, generate joy within myself, no matter what's going on around me, to find something to be grateful for. It sounds a bit trite, but it changes your state physiologically to just have a little gratitude for something. And then even just to think, hey, in this moment, can I just feel a little bit of joy, a little bit of peace? If everything's going mad around me, sometimes I'll just step away, close the door, and just have 60 seconds where I just breathe. And then I go, right, I can tackle this now. I can open the door, I can go back into it. And it only takes a moment, but it's that self-awareness to that background monitoring of yourself rather than letting it run riot and then responding and reacting to it. And I've learned a lot about myself having to do those things. Yeah.
And what I think is so beautiful here, though, is you know it from the medical perspective as well as the I guess the more, let's say, spiritual or whatever you want to think of it. I love how you just said to generate peace, to generate joy from within yourself. Now, this is coming from someone who's, very, very clever and understands the medical science behind it all. That, yeah, there is a lot of stuff out there now about, gratitude and breathing. But I love hearing those words come out of your mouth, that even in the work that you do and the pressure that you must be under to make decisions that literally, again, are life and death, that those are some of the practices that you use and they work.
Yeah, they
Like,
really
this is
do.
not just, woo-woo stuff.
No,
This
that's right.
actually works.
Yeah,
Yeah.
good
Yeah.
science behind it. And, I do have many aspects of my life which were challenging and hard, to thank for learning those lessons, and also just learning a bit more about what I can do for myself to be able to process and move through. And I really do. I'm quite different. That the person you see me for today is quite different to the 20-year-old and the 30-year-old and the 40-year-old,
How
because
so?
of that journey, but in a good way. And things don't ruffle me anywhere as much as they used to. Not because I
Why
don't
not?
care, I care, but I've got better ways to deal with myself, to deal with those things.
Oh, that's glorious. I've got better ways to deal with myself to deal with those things. And I guess that's come, as you say, that's come from, your life to date and the experiences that you've been through. And, to me, Jodie-Ann, this is a beautiful example of courage, that it's not just, the big stuff. Sometimes it is just something like prioritizing your sleep, or, generating that internal joy by stopping, pausing, breathing. None of this being rocket science, but how beautiful. So one of the things that I love about you is, and I've seen your incredible YouTubes on video, you're so relatable. Like, you're this super specialist, which, there's other specialists that we know and we've all been exposed to over the years. You just seem to be able to explain things in a way that people can understand. There doesn't seem to be this hierarchy of, you being the all-powerful kind of elder, wise one, and someone else being the novice beginner. I feel like you treat people really equally, and therefore what you're sharing really does, it hits harder or deeper, because I don't feel like you're just telling me what to do. You're sharing and giving. How do you do that? Because not all specialists or doctors do that beautifully.
I think you have to want to. Education to me is the foundation for, and again, I reflect back to myself. If I understand why I have to do something and I can ground it in something that inspires me to do it, then I'm more likely to actually do it. And I could say to my heart failure patients, right, you need to restrict your fluid intake to 1.5 liters every day. But the thing is, they go home and they're really dry in the mouth and thirsty, and if they don't understand why that's so important, then it's like a diet. You'll just go cheap, right? And then, I'll stand them on the scales, and the scales tell me the exact objective picture, no matter what it is they said they did. I know exactly what happened, in versus out. But if I can, again, link it to maybe even a story for them that gives them insight as to what they can transform in themselves to, and why that's going to be so much better for them, then they, 98% of the time, they're actually going to go and do it, even if it's hard, because they understand why, they understand what, and then they've linked that to, you're not just telling me to do something which I know I should do, but actually if I do this, I'm actually going to feel better. I'm actually going to get my life back. I'm actually going to be able to do more. My drugs are going to work better, and I'm going to have a better chance. And that's more likely to inspire them to do it than me just going, oh, you didn't do it. What's going on? Why aren't you just do it?
So, and that obviously explains the non-compliance, where people don't take the medication in the dose they're meant to, or don't do that. What else do you think stops people? So one is a lack of understanding of the why. Maybe two, as you say, when you put it into a story, they then can relate it better. So it no longer becomes, medical diagnosis. This becomes a story that they can connect into and relate to. Why else do you think we don't comply when we know that, the medical doctor has said, do this, take this tablet, and we still don't do it?
It's a very interesting one. And I can tell you it's a good example. I've had a situation a few years, well, it's during COVID, early parts of COVID. It was very sad. One of my dear older patients was struggling with heart failure, and she had a couple of challenges that did make fluid restriction a bit tougher for her, but there was also a part of her that just did not want to do it. And I looked, in many conversations I had with her, for the thing that might be the link to motivate her. So sometimes that is do it for your kids. Many mothers will do something for their children that they would not do for themselves. In fact, I happen to be one of those mothers. Yeah. I
Me
had
too.
open heart surgery largely not for me, not because I was afraid of dying, but for my kids who were very young at the time. And that's before I was a bit more enlightened and a bit more, about my own self-care. But that was the thing that that gave me the courage to actually go down a path I really was terrified to go down. Back to my patient, I had her adult kids saying, Mum, you've just got to do it. And, you do it for us or do it for yourself or whatever it was that they came up with. Her husband the same. And I tried a number of different ways, a number of different stories. And I worked out in the end that for whatever reason, she did not either believe she could do it, but also I think she did, her will to survive was gone, and she wasn't going to do it for anyone or for any reason. And I think that's hard when you have to accept, as maybe the loved one of that person, or even as me caring for her, that it isn't going to happen. I find that hard, but in most cases, this is the psychology part of what I do, is I will dig and ask questions and see and watch behaviours to see what it is that they actually are interested in. And I'll give you a side analogy here. Not one of my patients, one of my very dear friends. I lost a dear friend who was about the same age, 51-year-old male, and he died not so long ago. And this other friend of mine, I felt was like a mirror image of my friend I'd lost from a heart attack. And I was quite worried, and we were just hanging out in the pool, and I thought, right, I'm gonna do this. I'm gonna broach this topic, even though it's not going to be well received, and I'm gonna have this conversation around health. And he's great because he knows it comes from a place of love and care. But I had to work out what was the thing that would motivate him to do any of it that I was suggesting or recommending. And I knew the one thing he cared most about, apart from his work and his business, was playing squash. So I linked all my little, things like, if you lost a little bit of weight just through a little bit of good diet and maybe cut back on the snacks, you're going to play squash better. You're going to have better cardiovascular, effort tolerance, and you've got a bigger chance of beating your opponent, which I know he is very competitive about.
But you know what? If that's what it takes,
Yeah.
then, and that's going to motivate him to do whatever he needs to do. As you say, when you can explore and find whatever that thing is, and then use that as the trigger for the reason to make this change, that's where it becomes so much more positive.
Yeah, it's gold, because he wouldn't do it for any other reason.
And you know what? We've all got our own reasons, right?
Yeah.
But I think that's gold. And I think that's, the small amount of time I've had with you now and at the lunch, like that is what does set you apart, is you genuinely care. You care enough to dig deeper, to explain things and what have you. So just as we wind up, Jodie-Ann, what's the next thing you've got to reach in and find some courage to do?
Well, as you know, so my full-time job is as cardiologist, heart failure specialist, and probably now for a good decade, I've been brewing in the back of my mind is like, how do I get that education piece out there more? There are so many people I come across that, just for want of a better education around what they need to do to look after their health. It's not that the doctors are doing anything wrong, but maybe they're just time poor, or for whatever reason it hasn't connected in a way that the patient has actually understood what to do. They aren't doing the right things, and they wind up in this terrible mess and in hospital. And I think, gosh, if I just had have gotten to this point earlier, to been able to intervene 6 months earlier, that whole trajectory could have changed dramatically. And sometimes literally it's dare I say it, at last gasp that I'm introduced to someone. I'm just like, oh, it just breaks my heart, because I know where this is going, probably, sometime in the very near future. And to me, it's like, I think about my own work and my patients, and I like to give them that time and that education. And then I see them, in a large part, free of hospitalisation, free of suffering, returning to the things that they love and enjoy, being able to get to spend time with their family and doing the things they want to do. And that really brings me a lot of joy to see that. So that's great for my patients and anybody else who's lucky enough to have a great specialist that would help them in that same way, as there are, quite a few out there. But there are a limited number of us and a lot of patients with heart failure. And then I think about the people who just don't have access to maybe even any specialist, and they just got a GP maybe, and the GP's overrun with hundreds of patients, and maybe in a more remote area, we one-on-one are very limited. I'm very limited one-on-one with how many people I could actually help and make a difference to. So I was mulling over, well, how do I change that? How do I get the message out there and maybe help people I've never even met? That'd be awesome. Impact their lives and change things for the better, and or even just give them more understanding of their illness and their disease, and or prompt them to ask better questions of their doctors or seek help earlier, whatever that is, right? And so I thought about, for a long time, how could I get that education out there? And I did my bits and pieces within my areas and realms, but I thought it's still very limited. Of course, along comes COVID, and then there's, this rise of people who are becoming more accustomed to doing things via the internet, via Zoom, out of necessity, and patients who perhaps wouldn't have had a bar of that before, but now are embracing that as an opportunity. And it occurred to me that I should be brave enough to put on another hat and, in my spare time, try and build a platform that educates patients with heart failure so that they get that. And so it started in a different place. I've developed programs and books that I'm working at getting out there for people. But for the time being, I'm also doing the YouTube channel, which is Heart Failure Help Now. And I just want to break down, bits of that journey in steps and stages, in chunks that are sort of hopefully not too hard to digest, and help patients wherever they are get support, so that they have better understanding, that they know what their roles are potentially in their own health, and how they can actually empower themselves and get a better result with not just this sort of band-aided approach of applying medications. And look, in heart failure, to be fair, medications have turned around that situation for many patients and made a huge difference, but there's a bigger impact to be had just by patients being able to do their bit in a timely and efficient way. And then really it's not that difficult either. So, if it just takes someone explaining that to them, and then they can go off and develop that side of it with the help of their own health professionals, why not?
Oh, that is gorgeous. And also, if they can get onto it soon enough, maybe they never have to actually come and see you, as
Exactly.
gorgeous as you are.
Exactly. I mean, that would be just the greatest gift, to know that patients could get help wherever they are, especially if they're not getting that help. And, just being able to have more information about where you're at can relieve some of that stress and fear. I find, even for myself, if I have a better understanding of something that I'm about to face, then I'm not going to be as worried about it. And I can put more energy and focus into, well, what are the things I can do, rather than just being overwhelmed by, oh my God, what is going to happen to me? Am I going to die? Is this going to happen? What's going to happen? No, actually, there's lots of things you can do, and it can really change and impact the course of your health.
Oh, wow. And literally, this is life and death stuff. So,
Yeah.
really, really important. Wow. You are one courageous woman on so many fronts, and so many learnings and gold nuggets along the way that you either learned through work, in your own life, or by applying the stuff through your training and what you're doing. Thank you so, so, so much. I will put links for people to go and check out your YouTube channel. And then as you bring some of that training into the world, so that people can follow along and everything. So thank you, thank you, thank you, Dr. Jodie-Ann.
Thank
Thank
you,
you.
Kim. It's been a pleasure to be part of this, and I'm honoured to be amongst so many fabulous women that you've had on the program.
Thank you.